Broadly for migraine, there are 31 points of injection and each point we inject 5 units. Only 3 of the points are intramuscular and rest of the points are intradermal. So we'll start. First 3 intramuscular points are the belly of the process, the belly of the corrugator, the other side of the corrugator belly. So these 3 points are intramuscular, 5 units, 5 units, 5 units. In line with this corrugator point, mid forehead, the 4th point, and in line with the other one, mid forehead, the 5th point. Mid pupillary, in the same mid forehead, we have the other 5th and 6th and 7th point. So we have procerus and both bellies of the corrugators intramuscular, and then in line with this above, and in line with this above the 4th and 5th point, mid pupillary on the same line, 6th and 7th are the points for the forehead. The points basically after this 3 intramuscular points, these other points are intradermal. Then on the temple, if you draw a line, imaginary line drawn in front of the tragus, what do you call the tragus line? 2 fingers above the tragus is your point number 1. 1 finger width, another point number 2. Another finger width point between these two in a triangular fashion is point number 3. And then the highest point with the helix of the ear, point number 4 behind. So these 4 points basically 2 finger widths above, point number 1, 1 finger width, point number 2, 1 finger width in a triangular fashion, point number 3, and in line with the upper point, in line with the helix of the ear with the upper point. So 4 points intradermal each side basically is what we have. So 7 points and 4, 8, 15 points total. Then you see the mastoid tip, you feel the mastoid tip, and you have the highest nuchal point. The onion, actually this highest nuchal point and the onion, the mastoid tip between this point number 1 midpoint, 1 finger width, another point 10 o'clock, 1 finger width, another point 2 o'clock in a triangular fashion are the points of injection each sides. So mastoid tip, highest nuchal point, the onion, midpoint of this, point number 1, 1 finger width, 10 o'clock, point number 2, another finger width, 2 o'clock, point number 3. So we have 3 points each side. So 15 and 3, 3, 6, 21 points actually. These are the intradermal points. Then in a neutral position, 2 fingers in the groove, below on the nape of the neck, each side, 1 and 2. Point number 1, 10 o'clock, point number 2, another finger width, 2 o'clock. So 4 points. So 21 and 4, 25 points of injection. So this is for the nape of the neck. Then coming to the trapezius muscle actually. Coming to the trapezius muscle, each side what we have, infliction from the acromion joint actually. So from the acromion joint to the infliction on the trapezius, that means little behind on the muscle, midpoint. Alright, midpoint of this is the point, first point, intradermal. From the midpoint to the acromion joint, again a midpoint basically is point number 2, and from infliction to the midpoint of this another 3rd point. So central point between the infliction and the acromion joint, point number 1, between the central point and the acromion joint, point number 2, between the central point and the infliction of the neck, point number 3. 3 points each side. Intradermal on the trapezius muscle. So 25 plus 6, 31 points of injection. So a total of 31 points, 5 points, 5 units each point, and only 3 procerus and corrugators intramuscular, rest of the points intradermal. So after these injections, we will have to wait now for more than 4 to 6 weeks. In 4 to 6 weeks, patient will start to feel reduction in the intensity as well as the frequency of headaches or the migraines, and this will continue, and past 8 weeks patient will feel that substantial reduction in the the migraine pains and the frequency is happening, and they'll be very happy. And this will keep out, I would say the first session will give the results as long as 6 to 8 months. And if repeated, once the patient again start to feel that probably my migraines are coming back, you can repeat the session, and then it's gonna be longer, as long as 8 to 10 months. So this is fairly a great deal that you can give a break of on an average of a year to this patient by doing a very simple technique of botulinum toxin. Thank you.